afternoon. Happy Friday. Good afternoon, everyone. As always, I want to thank you for continuing to tune in to these press conferences. They continue to be a very helpful way to keep yourselves informed. Next week, I'll be here on Monday and Wednesday, but not on Friday. So press conferences next week are 1 o'clock, Monday and Wednesday. I know many of you have said that you're back to work now or in the flow, which is a fabulous thing, so it's hard to tune in at 1 o'clock. You do, though, need to stay informed, especially next week. There'll be a lot of phase 3 announcements. So I would encourage you to sign up for the daily emails. You can do that at my website, governor.ri.gov, governor.ri.gov. We'll send you an email every day, which is a summary of this press conference, and on Saturdays, you'll get a summary of the week. It's my goal. I know I hear from people every day how much anxiety there still is around coronavirus. People are struggling to get accurate information. If you watch the national news, it can be quite scary. So my goal is kind of to allow you to leave the worrying to us, and we will provide you with information that we think you need to have in order to keep you and your family safe. So I hope that you'll sign up for the email, tune into these press conferences when you can, and keep yourselves informed. What's happening in Rhode Island is very different from many other states, and if you follow the rules here and stay informed here, you should feel confident that we're in a good place as it relates to the coronavirus. And with that, we'll begin with the data, which is another good news story. We have had weeks of good news now. We really have an excellent trend. We continue to see a good trend. Today, we report 25 new cases, very few new cases, and very sadly, another 7 deaths. It's very sad that we continue to report deaths every day, and our hearts go out to the families who are experiencing a loss of a loved one. Having said that, I will say this. This could change very quickly, and we are foolish if we deny that. We are foolish to think we're out of the woods, the crisis is over, and we can go back to life as normal. Because if we do that, if we stop following the rules, stop wearing our masks, stop washing our hands, staying home when we're sick, we're going to be in trouble just like that. And if you don't believe me, look at what's happening in Texas and Arizona. They have closed their hospitals to elective surgeries and non-critical surgeries and non-critical procedures because their hospitals are full with coronavirus patients. And their governors are telling them, please stay at home. We don't want that to be Rhode Island. And my heart goes out to the people in those states. Yesterday was a record high for new cases of coronavirus in the United States, more than 40,000 cases. I don't want that to be Rhode Island's story. That shouldn't be Rhode Island's story. That's not our story now. And if we keep following the rules, keep ourselves informed, that won't be our story. And to those of you who are out there who are saying, I think the virus is over, I don't feel like wearing a mask, don't tell me what to do, I'd like to say this to you. This virus has had a devastating effect on our state, devastating. Tens of thousands of our friends and family out of work, businesses wondering if they'll be able to survive, nearly 1,000 lost lives, and many, many more lives disrupted because of the virus. We have the power to prevent ourselves from going back to where we were in March and April. But each and every one of us has to acknowledge we have a shared responsibility to one another if we're going to stay safe. And so I just have to continue to remind you and remind myself of that shared responsibility. If you own a restaurant and you aren't following the rules, You're hurting every other restaurant's ability to stay open and your own. If you are a shopper, if you go out shopping to retail operations and refuse to wear your mask and get angry when you're asked to put on a mask, you're putting in jeopardy every retail shop's ability to stay open and those people's right to have a job. So listen, I'm not trying to say this is easy, because it's really hard. But I don't want to have to go back a phase, shut down businesses, not open school. And we know we have a formula right now in Rhode Island which is working. A lot of testing, a lot of contact tracing, and people following the rules, wearing masks, keeping 6 feet apart, not going into the office unless you have to, staying home if you're sick. And so I'm asking you, please, to continue to follow the rules, because as sure as we're here today, which is a place of confidence and relative safety, it could change in a week if we stop following the rules. And so I'm asking you, please, to not be lulled into a sense of complacency since we're in a good place right now. And by the way, that will be that way until, for those of you who say, how long is until we have a medicine that works or a vaccine that's effective and available to everybody. And I don't know when that'll be, but when it happens, that's when it will be. On Monday, I will be making an announcement about when we will enter phase 3. Earlier this week, I have been outlining what phase 3 will look like. And if you haven't been able to see that, you can go on Reopening RI. We have guidelines there around what phase 3 will look like. It's even a broader relaxation of retail, restaurants, a broader opening of our economy. I'm not yet ready to make that announcement today. My executive order expires at the end of the day on Monday. And so we're going to take the weekend, assess where we are, consult with experts, look at where these other states are, and then on Monday, I will be back with an official announcement about when phase 3 will begin and exactly what phase 3 will look like. I will preview now that the thing we are most focused on for phase 3 is very large events, because we are learning from the difficult experience of other states that large events are obviously a real problem. So we're going to spend the weekend doing a little bit more work, and I'll be back Monday with clear details on when phase 3 begins and exactly what it's going to look like. That means this weekend, we're still in phase 2, social gatherings of 15 or fewer, mask wearing, 6 feet apart, taking precautions, calling your doctor if you're sick, washing your hands, and really just social distancing. Social distancing. It's not rocket science. This isn't rocket science, but it's also not easy. And I would just say, I do this for myself, if you find yourself close to people for more than a few minutes, we're doing something wrong, unless it's your family or people you're always with. I want to talk for a minute about some of the businesses that have begun to operate in Rhode Island, because businesses are doing pretty remarkable things out there every day, being flexible, innovative, many just trying to survive and doing what it takes to get through. And I want to share with you some of what I saw and let you know just how impressed I am with the businesses of Rhode Island. I spent some time yesterday at Citizens Bank. Citizens Bank is one of our larger employers in Rhode Island. They have a beautiful new headquarters building in Johnston, Rhode Island, with well over 1,000 people. Several thousand people are meant to work at that facility. And I was unbelievably impressed with what I saw. The majority of people are still working from home, which is they're following that rule. If you can work from home, we're asking you to work from home. If you need to pop into the office occasionally, do that, but primarily work from home. If you have to be in the office, Citizens seems like they have a great model. They have markers all over the floor to show you where 6 feet is. They're enabling outdoor work. They have a big campus, so they're being very creative around how using their outdoor settings, their outdoor tables and chairs, hand sanitizer everywhere. This was something I was impressed with. Nobody can actually return to work until they certify that they've gone through an online COVID-19 training session. So they're making every employee get trained on the new rules and regulations around how to stay safe in COVID-19. It was very impressive. One of the coolest things, at least I thought it was cool, is they actually have a gym in their corporate headquarters. The gym is not functioning because they don't think that's safe to have folks using the showers. So they've turned it into a supply warehouse for hand sanitizer and PPE, and they've created their own hand sanitizing bottling operation at the campus gym, which was a very impressive operation, and they're never going to run out of hand sanitizer. Now, they're, of course, a very big company. Most companies in Rhode Island are small businesses. The average Rhode Islander, the majority of Rhode Islanders work at businesses that have 50 or fewer employees. So I visited White Dog Distilling in Pawtucket. They have a handful of employees. It's a very small space. So what they're trying to do is very hard, and they're doing a fantastic job. They're getting creative, leaving the doors and windows open, pushing the operation outdoors. They pitched a small tent in the parking lot. They have tables there. For a while, they were actually producing hand sanitizer. They're experts in making moonshine, which turns out to be a key ingredient in hand sanitizer. So they got very creative. Now they've turned back to their main business of making fantastic whiskey, but they still make their own hand sanitizer. So hats off to them. Chi Kitchen, best kimchi around. If you haven't had it, you ought to try it. They sell it in supermarkets. They make kimchi. I have to say, it is the cleanest kitchen I've ever seen in my life. And again, small number of employees. They probably have 10 or fewer people in a small area. The place was immaculate. Everyone, including me and all of my team, had to fill out a checklist. Each one of us got our own pen. We filled out our checklist around how we're feeling, et cetera. We attested to it, had to wash our hands. They made provision for social distancing, took apart the lunchroom, like really fantastic, but open for business. People were working. It was a beautiful thing to see. And then I was also able to visit the District, which is a very cool restaurant in Providence. Again, a small restaurant, so a challenge. Once again, they got creative. The woman, Jen Freitas, who owns it and operates the District, got smart, creative. Her neighbor across the street has a parking lot that's mostly empty after 5 o'clock. She asked permission, and now they have expanded their outdoor dining in the across the street parking lot, which allows her to stay open and helps her survive. Inside, immaculate, and lots of signage everywhere telling people you must wear a mask. Waiters and waitresses and bartenders had their masks on. I noticed folks in the kitchen had a face shield on, really top notch. So I'm sharing this with the people of Rhode Island for a couple of reasons. One, so you'll find some hope and energy and inspiration in what's happening in our state, small businesses being creative and innovative and doing what it takes to stay open and survive and keep people working. But two, to encourage you, if you're still afraid to go out, to go ahead and get out there. I know it's scary. I know a lot of people are still afraid to go out for dinner or go back to work. They were telling us at Citizens Bank they're inviting employees back. Most employees say they don't yet feel ready to go back. I'm just sharing with you, you should get some increased confidence because these businesses, large and small, have done a fantastic job figuring out how to follow the rules so you can go to work and go out and be safe. Go to work and be safe. We need to get to a place where it's not one or the other. I'm not telling you to be reckless. In fact, I'm telling you not to be reckless. I'm telling you to be smart and take precaution, but go ahead and start to get out there, get back to work, get out to eat. go out and enjoy your lives with the new rules and have some confidence to know your employers are doing the right thing. And I will say again, when I'm out and about talking to small businesses, talking to bar owners, talking to restaurant owners, they are the ones who are the most frustrated with their colleagues and peers in their industries who aren't following the rules. So if you're a laggard to rule following and you're mask wearing, I'm asking you to join the club and do the right thing because it'll make us all safer. Okay, this is the most important announcement that I would like to make today. And it relates to our children and a potential public health crisis that we could have with our children if we don't act with urgency. So 2 or 3 weeks ago, I announced that Dr. Alexander Scott would be convening for us a COVID-19 Pediatric Advisory Council. And a group of pediatricians, we called on them to advise my administration around how we best take care of children and their health through the pandemic. And first, I want to thank all the pediatricians who have volunteered and helped us on that task force. You're doing a remarkable job. I have to thank our Medicaid director, Ben Schaefer. I don't think that guy's had a day off in 5 months. He's amazing. And Marie Gannam, our energetic and brilliant health insurance commissioner. Marie and Ben and Dr. Alexander Scott have convened the group of pediatricians many times over the past month, mostly focused on the issue of how we address the alarming and precipitous drop in childhood immunizations that we have seen, and childhood well visits, baby well visits and child well visits over the past several months. We're behind. It's a problem. It's going to manifest itself in big problems in the winter if we don't get these kids checked and immunized. Parents, if you have a child who is under 2, a baby, or you have a child who is age 4, age 11, or age 16 and needs a vaccine, or you're behind on the vaccine, or you missed a well visit, or you missed a screening in the past few months because of coronavirus, I need you to call your doctor today or next week and get an appointment with your pediatrician or your primary care provider. We intend to open school August 31st. We want these kids back in school in September. That means we need them all immunized and checked. Babies under 2 have to have a certain set of shots. 4-year-old, it's key, 11 and 16. So if, like many of us, you've gotten behind, listen, we're not blaming anyone. We've all gotten behind. We're all out of our routine. We've all been scared to go to the doctor. But we need to do this. A few weeks ago, I announced that we're going to use several $1 million of our COVID relief fund to support pediatricians in order to be able to do this. And they're going to get very creative to make it very convenient for you. But it's important that we make this happen. The pediatricians on our advisory group are cautioning, warning, especially for our 4-year-olds who are going to start pre-K in the fall for the first time. We absolutely must make sure every single one of them has their measles, mumps, rubella vaccine shot. The MMR must get that shot. Now let me tell you why I'm alarmed. In April and in May, the thick of the crisis, we saw a 52% reduction in immunization rates for kids between ages 2 and 7. Some estimates are that it's even greater than 52%. We cannot accept this. We as a community have to get on this. We don't have a lot of time to fix it. We basically have the summer to get these children immunized, which is why we're getting creative. But if we don't, we're going to have real issues when school opens, when flu season starts, and when the winter comes. Now, I understand if you're a parent hearing me, you might be saying, I'm still afraid, Governor. I still am afraid. I still don't want to, I'm afraid to go to the doctor. My child has asthma, underlying health condition. I'm afraid to leave the house. I'm afraid to get on the bus to take my child to the doctor. I hear you. I understand that. And I am not minimizing that. So here's what I want to suggest. Take a minute, go on reopeningri.com and click on healthcare. Reopeningri.com, click on healthcare. We have a lot of pictures on that website. The pictures are designed to show you what it's going to look like when you go to your pediatrician's office, or you go to a health clinic, or you go to your family care provider. I want you to hear this from me. Your physicians are taking extreme caution to make sure that you and your kids are safe. Extra cleaning, extra mask wearing, extra sanitizing, infection control. They are bending over backwards to make sure it's safe for you to take your children in to be immunized. I have to tell you, at this point, the bigger risk is you not taking your children to get immunized. So I'm asking you to get smart, take precautions, wear masks yourselves, call us if you need help, call your doctor. Your concerns are real, but I'm telling you a much bigger concern for your children and for the whole state is if we don't get these children immunized. Are the pediatric advisory groups going to be working with the state all summer long? You're going to hear me talk about this all summer long. We are going to be leading a statewide forum for pediatricians, and we're going to be reviewing the data constantly. We have to get half of our children immunized in 2 months. So every week we're going to be looking at the data. Where are we? Where are we? Are we going up the curve? To a good curve to make kids get their immunizations. These physicians are going to share best practices. I also want you to know they're getting very creative. They're going to have office hours late at night. They're going to have office hours all weekend long. They're going to have special immunization clinics. We are going to work directly in partnership with school districts. Also, I want to make sure every child gets immunized, everyone. Rich, poor, black, white, undocumented immigrant, regardless of immigration status, wherever you live, we want every one of these kids to be taken care of and be healthy. So we're working in very close partnership with schools, school districts, DCYF, foster care agencies, communities, family health clinics. We all have to do whatever it takes to keep all of our children healthy. If you're hearing me say this and your child does not have health insurance, which is very unusual, but we don't want anyone to fall through the cracks, give us a call. Call the health exchange. We'll figure out a way to get your children immunized. Or call 855-840-4774, which is a health exchange number, and you can learn about health coverage available to your child and your family. I'm personally going to get constant weekly updates on this because this is a statewide public health initiative. And as I said, at this point, even though we're very much still dealing with the virus, and as I said at the beginning, coronavirus isn't gone, this is going to be a bigger problem if we don't address it. So everyone has a role to play. If you're a parent, go home and check, have my kids been immunized? If they have, call your friends and ask them. If you're a teacher, check in on the families, preschool teacher especially, child care centers, DCYF social workers, mental health workers, pediatricians, all hands on deck. Next 2 months, let's get all of our kids immunized. 2 more quick announcements. Last week, I announced the We Are One Rhode Island Fund. It's a fund. We're raising private money, no taxpayer dollars, to provide direct cash assistance to Rhode Islanders in need, Rhode Islanders who, because of their immigration status, are unable to benefit from most public programs. As I've said, these are our friends and neighbors. These are Rhode Islanders, and they deserve our support. We've partnered with Dorcas International, Rhode Island Foundation, Good World, Progreso Latino, and it's going very well. I reached out to you 1 week ago to ask you to please donate if you could. You have sent in $122,000. I think that's incredible. In the face of a pandemic, when people are busy, worried about money, over $100,000 in less than a week. I'd like us to see if we can get to $150,000 by the end of the month. $150,000 by the end of the month. So if you're hearing me and you have a little extra money, please text "We Are One," the number 1, to 27126. Donations of any size matter. I would like to say this. This is $400 that each person is getting. This money is, we know, primarily going to be spent on food and essentials. That means there are many, many people in Rhode Island right now who have had no access to federal aid and who are literally struggling dollar by dollar to put food on their children's table. So I'm leaning into this initiative. This is what Rhode Island's all about, taking care of one another. Thanks to you, $122,000. Let's get to $150,000. Please text "We Are One" to 27126. Finally, and relatedly, I have been up here every day talking about our most vulnerable, people who are low income, live in high dense communities, and particularly who are housing insecure. Housing insecurity is always a problem. It is particularly a problem now because homeless folks are very vulnerable to the disease, and if they're not in homes, they're more likely to spread the disease. So it's always in your interest to make sure no one's homeless. It's particularly in your interest now to work with us to make sure no one's homeless. A few weeks ago, I announced the Housing Now campaign in partnership with the United Way and the Rhode Island Realtors Association. And at that time, I set a goal. I asked realtors, landlords, to pledge 100 rental units by July 1st to people who are on the verge of homelessness, but who have a housing voucher and therefore are able to pay rent. And we're incentivizing you. We're giving landlords $2,000 signing bonus if you take one of these folks in as a tenant, and an additional $500 for every additional unit, and we'll help pay for minor renovations if you take these folks in. Right now, we have 61 units pledged. I want to go from 61 to 100 by July 1st. Call the United Way, call the Rhode Island Realtors Association, call my office, call 211 if you need an apartment and you have housing vouchers, or if you're a landlord and you're willing to rent. But I'm asking everybody, if you're a landlord, pledge a unit. These are people who have a steady income and can pay the rent. And we're giving you thousands of dollars in incentive to do it. It's the right thing to do, and it's good business. We only have 39 units left to go. When I announced this the other day, we got a lot of questions saying, "Governor, why are you doing this? These are people that have a housing voucher and an ability to pay the rent. Why do we need to do this?" So I'm going to tell you now why we need to do this. Currently in Rhode Island, it is not against the law for a landlord to discriminate against a tenant, against somebody, on the basis of their income, or on the basis of their kind of income, which is to say, you're allowed to turn someone away because you don't want to rent to somebody who has a housing voucher. Now, I think that's wrong, and I've supported legislation year after year to outlaw discrimination for renters on the basis of the source of their income. And I am asking the legislature again this year to pass that. I believe the Senate's already passed it. It's in the House now, and I hope the legislature does the right thing, passes that law, and I look forward to signing it. But that's why we have to do this, Because currently it's perfectly allowable for a landlord to say, no, I don't want to rent to you. You have a Section 8 voucher, you have a voucher. Even though that's a source of income, reliable source of income. We know from our own experience and the experience all over the country, we cannot afford to have homeless people in the middle of this public health crisis. And really, we never can. Homelessness is never okay. So that's why we're using some of our stimulus monies in order to provide an incentive for landlords to encourage them to do the right thing. And it's a huge help as we face the public health crisis, because we need everybody to have a stable home so they can be healthier, quarantine or isolate if they need to, quarantine or isolate their kids if they need to, and keep themselves healthy. So landlords, please step up. To the 61 of you who already have, thank you for leading the way. And to folks out there who need a hand, you can call 211. Okay, with that, I'll turn it over to Dr. Alexander Scott.
Thank you, Governor. Good afternoon, everyone. Happy Friday. I want to also take a moment to again recognize and thank the members of the COVID-19 Pediatric Advisory Group and all the pediatricians and primary care providers throughout Rhode Island. As we've said many times throughout our COVID-19 response, it is critical that people continue to get preventive care. The commitment, patience, and flexibility of our providers have allowed that to happen. So thank you. We definitely want to keep that going strong. It's because of the providers and school nurses and teachers and families that Rhode Island has historically been #1 in terms of childhood immunizations. We want to use this time over the summer to help keep us at that high level. And thank you again to the Pediatric Advisory Group for guiding us towards that path. I also want to thank all the child care providers throughout the state. Supports such as childcare are incredibly important to ensuring health at the community level. So a huge thank you to you as well. In terms of numbers for today, we have 25 new cases to report. There are 91 people currently hospitalized across the state. 16 people are in the intensive care unit, and 15 of those 16 people are on a ventilator in the ICU. Sadly, we have 7 new COVID-19 associated fatalities to report. 2 of these people were in their 70s, 2 of them were in their 80s, and 3 of these individuals were in their 90s. Our prayers are with the families of these dear Rhode Islanders who we have lost. I want to take a moment now to return to an issue I addressed several weeks ago, something called multi-system inflammatory syndrome in children. Multi-system inflammatory syndrome in children is a rare condition where different parts of the body can become inflamed, including the heart, lungs, eyes, and gastrointestinal organs. While this condition is not contagious, many children with this condition have had the virus that causes COVID-19. The symptoms of multi-system inflammatory syndrome in children can vary, but they include symptoms that reflect involvement of the many organs. It requires that someone has had fever that lasts 24 hours or longer and has some of the symptoms that involve the heart, lungs, eyes, or gastrointestinal symptoms. So someone could have vomiting and diarrhea, pain in the stomach, a rash on the skin, red eyes, redness or swelling of the lips and tongue, redness or swelling of the hands or feet. Although multi-system inflammatory syndrome in children can be serious, most children who have been diagnosed with this condition have gotten better with medical care. I'm sharing with you that yesterday Rhode Island confirmed its first case of multi-system inflammatory syndrome in children. While this is a rare condition, a case was not unexpected, given that cases have been seen in other states. We have done well to not have a case up to this time as a reflection of the fact that there have been very low numbers of COVID-19 cases in general in children. The child who was diagnosed in Rhode Island is currently hospitalized. However, she is not in the ICU and is on a regular floor and is doing well. This child's COVID-19 test was positive. Beyond what I've shared just now, and beyond saying that our best wishes continue to be with this child and their family, there isn't anything more I'm going to say specifically about this case today. I know that multi-system inflammatory syndrome in children may sound concerning, but I want to reiterate that we are talking about a rare condition. That's signaled by the fact that we discussed the possibility for it several weeks ago, and at this time now is when I'm sharing that we have our first confirmed case in Rhode Island. I also want to reiterate that multi-system inflammatory syndrome in children is not contagious in and of itself. A child cannot catch multi-system inflammatory syndrome from another child. This is a relatively new condition that we have more to learn about and will continue to be, but it appears to be a condition that results from the way the body reacts to COVID-19 in an individual in rare instances. What I can share with parents is that this is another reminder for parents, for children, and everyone else to continue to take steps to prevent the spread of COVID-19, the same steps that we have been talking about. Decreasing the risk of spread of COVID-19 simply means then the chances of even having to deal with multi-system inflammatory syndrome in children is almost negligible. It's very, very low. You have to actually have been exposed to COVID-19. So we want to help make sure that everyone has the tools and information that we continue to share about how to stop the spread of COVID-19. Keep your hands clean. Do that for your children. Wash hands often with soap and water for at least 20 seconds. You can sing happy birthday twice. If soap and water aren't available, use a hand sanitizer that contains at least 60% alcohol. Wearing your mask when in public. This is something for children who are developmentally able to do that can be encouraged, can be done creatively. It can be seen as something that is helpful, and it's something we want to do across the board, especially for adults to be able to model this for children. Also, avoiding contact with people who are sick. In particular, avoid people who are coughing, sneezing, or showing other symptoms. That's also stated to say if you have any of those symptoms, it is critical that you stay home. Continuing to practice social distancing, meaning keeping a distance of at least 6 feet. This is something we as adults can model and can continue to encourage children to be informed of as well. Cleaning and disinfecting high-touch surfaces every day is something that we all can do directly. This includes cleaning light switches, remote controls, phones, countertops, keyboards, and faucets. Lastly, I want to give one quick update on the situation at the vet's home. I want to help make sure that everyone is up to speed on where things stand there and the amazing progress that has been made with a tremendous amount of work, team effort, and strong leadership. To date, 19 residents at the home have tested positive. Very sadly, 5 of these individuals have passed away, and all 5 of these people had underlying medical conditions. The vet's home did a very good job comprehensively responding in partnership with our support at the Rhode Island Department of Health. That included working very closely with the Rhode Island National Guard, who I've said again and again has been invaluable to us as a state, as a key part of this response. The National Guard, in collaboration with the administrators at the nursing home, were on the grounds at the vet's home, quickly and early, providing testing that has been done aggressively and comprehensively. 4 rounds of cyclical testing have been completed thus far at the nursing homes, and we will continue that going forward, particularly for the staff, so that we can continue to stay vigilant in ongoing monitoring. We also worked quickly and closely together to help ensure that residents were grouped together and cohorted, and will continue to do that to ensure that those who are COVID positive are separated from those who were COVID negative as a way to stop the spread. And that was an effective measure that continues to be done as needed there, as it is at all of the nursing homes and congregate settings. Like many other congregate living settings in Rhode Island, there have been challenges at the vet's home. But given the results that we are seeing, where there are not any further cases that exist there, and given the ongoing vigilance that is continuing to be applied with the leadership who's there that has done an excellent job, we are thankful for all of the work that has been done and will continue to be done to keep our veterans safe and their loved ones informed. So with that, I'm going to stop and open us up for questions.
Can you tell us the age of the child who has the multi-symptom syndrome?
School-aged child.
Can you tell us the zip code of that patient?
I'm going to stop there in terms of the amount of information that we share.
Doctor, the governor gave us a lot of ages of children who are in need of immunizations. Can you give us what's the age of children who are in need of immunization? How many children do you anticipate are going to need these shots?
Well, as the governor shared, we have about 50% or so of our pediatric population to be able to catch up with. We definitely want to emphasize those ages, particularly 4 years of age prior to entering school, and the 11 and 16 years of age, because as children get older, they feel it's less of a necessity. So we want to strongly encourage that, and continue certainly those that are less than 2 years of age.
Can you estimate how many kids we're talking about?
I can get that number to you.
Dr. Will there be any effort to enforce immunization as a condition of enrollment in public schools?
We will continue the current practice that we have that actually has led to why we've been so successful with immunization. We'll work closely with schools and school nurses to enter school. Getting your vaccines up to date is an important component. It's a tool that has been valuable in helping to ensure that all children from every zip code receive the vaccines they need.
Governor, what is your reaction to, I know this came up in Narragansett a while ago, but the Burrville Town Council the other night passing a resolution basically rebuffing your executive order, saying it infringes on constitutional rights. And I know 2 days ago you said this isn't about politics, it's about science. What's your thoughts?
I think that's still my reaction. I don't have much of a reaction. The law is the law. As the chief of police said there, it's his job and his officers to enforce the law. And I expect it to be followed throughout the state. We feel very confident that I'm on firm footing in a state of emergency to do what's necessary to keep people safe. I'll also say this, we haven't had a heavy-handed enforcement approach This came up in Narragansett. It came up, I think maybe in, I can't remember, another town. And, you know, it's the job of police officers to de-escalate, and they've been doing an excellent job of that. So I think that we ought to stay out of politics, stay focused on keeping people healthy, and stay focused on following the law.
With what's happening in other states, I mean, do you feel like your approach has been proven right? And I know I've asked you about critics and saying you've overstepped. Do you feel like this basically says to them, I'm right and you're wrong?
Well, I wouldn't say it that way, but I would say what we're doing is working. So you can't really argue with it. We've tested the equivalent of 22% of our population, and we have a test positive rate of less than 2%. We were the first state in our region to reopen our economy, and we still haven't seen an outbreak. We never closed down manufacturing, and we haven't had an outbreak. So yes, I mean, I would say this formula that Rhode Island has, aggressive testing, aggressive approach, mask wearing, is working. And so I don't have a very open ear to folks who say they just don't agree. Because unless you can show me facts which say this is the wrong approach because it's not working, that I'll listen to. But we don't feel like following the law is not very interesting.
Well, Governor, to talk about phase 3, so your executive order on phase 2 ends Monday.
Correct.
Monday is announced today. Is
Correct.
Tuesday still on the table?
Yes.
So you could say Monday if it's Tuesday?
Yes, thank you, Ted. And one thing I neglected to say, I'm also going to be addressing on Monday travel restrictions in addition to phase 3 announcements. Exactly, meaning involving these states. We talked about that the other day. We are likely to do something around that. In fact, I want to do something around travel restrictions for people traveling from other states to Rhode Island. It's easier said than done to figure out all the what ifs and how you execute it on the ground. So we're going to take the weekend. I would say, yes, Monday, it's likely possible that I will come up here and say phase 2 begins Tuesday. Excuse me, phase 3 begins Tuesday. We may have some modifications to what I've previously rolled out around large gatherings in light of what we're seeing in other states. And I'm also going to address travel restrictions.
You mentioned on CNBC the other night, potentially having mandatory testing. Is that still something you're considering?
Yes, yeah, that's exactly what we're considering. And what we're trying to figure out, I'll just be very honest, what we're thinking about is how do you do it? Is it enough to make somebody a test that they had a test in their home state within 72 hours before they came here? Or do we have to test them once they're here? How do you find these people? So it's a good policy. Actually, you know, people come by boat. A lot of folks have their boats up here coming from Florida. People have already rented homes. They might already be here for their summer vacation. So it's a good policy. It's hard to figure out the details. Luckily, we have excess capacity in testing, so we want to try to use testing. So we need to work this weekend. The bottom line is, look, I'll be very, very honest. Things are changing. I didn't, you know, you have the governor of Texas telling people to stay at home now. The hospitals filled in Arizona. North Carolina is having problems. South Carolina has a lot of hot spots. So I just have to pause, study, reassess, and we'll be back Monday. And hopefully on Monday we'll say phase 3 starts Tuesday.
Different place than you were a week
Yeah.
or so ago based on what we're seeing.
Yeah, at least, yeah. I would say, I don't know if I'm in a different place, but it's my job. It's my job to pause, reflect, dig into the facts, and make sure we're ready. And so that's what I'm doing.
Governor,
Okay, you need to call on.
Governor, we've discussed the Christopher Columbus statue.
Mm-hmm.
And on Tuesday night, there were 100 Providence Police, State Police there because people showed up that had ropes and hammers and they were going to tear it down. Wednesday, it had a 24-hour police presence. Mayor Alorza made the decision, not you, but yesterday it was brought down. Can we agree the statue was removed for threats of violence. Is this the new Rhode Island where mob rule makes decisions on how things are done?
We can't let that be the new Rhode Island. Listen, I think the mayor did the right thing. I do. I think it was his decision, as you say.
But do we agree that's why? It was because of violence.
Absolutely.
People were going to rip it down.
I believe so. You should ask him. But I believe the calculation was, at this moment in time, that's attracting violence and could be an issue, so remove it. And I think in light of the circumstances, that was smart. But I think we're in a moment right now of extreme anxiety, uncertainty, economic unrest. And I hope, no, that's not the new Rhode Island. The new Rhode Island, when we come out of this, is going to be better and stronger and safer and healthier than the old Rhode Island. But in this moment right now, we are struggling. And so I think the mayor decided if he could remove that to alleviate tension of the threat of violence, it was a good thing to do.
Do we know what the demands are for next week? Are they going to climb the top of the State House and rip the Independent Man down?
We're going to do what we need to keep peace. Peace.
Follow up on Ted's line of questioning. Do you anticipate reintroducing checkpoints on the highways
No.
to check people as they come to the state?
That is not what we're considering at the moment. We are considering working with the airlines in the airport, people coming from faraway places through our airport, maybe the train station, possibly partnering with realtors, for people who have rental properties, make it part of a contract, testing, working with companies. Business travel is going to start to pick up at some point in time, not tomorrow, but maybe in 2 months. So, working with big companies that do a lot of travel. So that's how we're thinking about it.
Governor, how much of your...
Governor Raimondo, in the recently released 2020 report of the Advisory Council for Locally Administered Pension Plans, and I want to note this was pre-COVID, 21 of the plans were less than 60% funded, considered to be in critical status. 6 plans actually reduced funded status since 2012. As the principal architect of pension reform, are you or is the state of Rhode Island involved in any substantial conversation with municipalities should further market disruption threaten your viability?
So we are available to support and assist, and we have a whole team of people who actually report to Brett, who do municipal finance. But every one of these cities and towns has their own separate systems, which they've negotiated on their own, which are set out in a contract. So I have zero appetite to pass a state law to break a local contract that was bargained for by municipal leaders and their local unions. Having said that, what you share, that's alarming. And I would strongly encourage mayors, town managers, et cetera, to figure out how to fix that. Because if you have a system that is, as you say, whatever, 20% funded, you're at serious risk of someone not getting their pension down the road. And so I would say that someone has to say the buck stops here, we're going to solve this, and municipal leaders have to do that.
Thank you.
Governor, how much of your thought process going into phase 3 is based on what's happening elsewhere? Because as you keep saying, Rhode Island is in good shape, and Rhode Islanders hear this and are like, we're following the rules, we're doing well. How much of that is a factor? And I know it's only a couple of days until Monday, but the people who are seeing this and now we're trying to make 4th of July plans, either a family coming up or something like that, what do you say to those people?
I say just wait till Monday. Look, my original executive order expired Monday anyway. We've already laid out what phase 3 is going to look like. So I'm just saying, hang on for the weekend, and we'll come out on Monday and make an announcement. That's a very fair point to say, listen, Governor, we're not Texas, we're not Arizona, we're doing fine. Having said that, something's going on in these states. And I just feel it's the responsible thing to do to dig a little bit more into it, have some more conversations, and frankly, just to see a few more cards of our own data. We started, here's the thing, how we think about it. Phase 2 started on a particular day. People didn't immediately go out the day after phase 2 started. Like I said, okay, restaurants are open, you can go get your hair cut on a particular day. We noticed it took about at least a week before people were really going out to dinner, getting their haircut, getting their nails done, going back to work. So, you know, we'd like to see today, tomorrow, Sunday, what does our rate of spread look like? Make sure there's nothing. A few more days matters. And it might be hard to understand a few more days matters, but it does. And so even though we started phase 2 on a particular day, it didn't really get started for another week. So it's just a tiny bit of extra caution to make sure we're doing everything we can to keep people safe.
So I don't want to put you on the spot for a counterfactual assumption, but your strategy overall over the long term, as I understand it, is to replace physical restrictions, staying at home and that kind of thing, closing down retail businesses, with increased testing, increased isolation when people test positive, rapid response, and contact tracing. Would you say that those strategies are able to completely replace the shutdowns, the economic effects that we've had, or nearly so, and that if we had that kind of aggressive testing, isolation, contact tracing months earlier, we may not have even needed the economic shutdowns?
Okay, so I would say, here's what I would say. It is absolutely true. If we had had, as a country, better testing, better PPE, better access to the supplies we needed, better contact tracing immediately, we would not, in my opinion, have had to do the radical and immediate lockdowns that we did. So if the federal government in January started to prepare properly and made massive investments in testing equipment, testing supplies, PPE, helping governors, logistics, it is quite possible that by the time March and April rolled around, we would have had other arrows in our quiver other than a lockdown of our economy. To answer your other thing where I don't fully agree, listen, if we told everyone to stay in their house and not leave for a year, yeah, that would be effective as it relates to the virus. But that is a terrible idea, because then, for all the obvious reasons. So what we're doing here is a balancing. People need to work. Our economy needs to function. People need to have social interaction. People need to go to the doctor. I just told you I'm so worried about these children who aren't immunized. So I have found that in order to allow people to live their lives and do what they need to do, what you need to do is have this aggressive approach around testing, contact tracing, quarantining, isolation, et cetera. And to Brian's question, here's what I don't want to do. I don't want to say we're moving to phase 3 and then in a week or half, 2 weeks, saying, we should have waited, pull back. I'd rather take a couple more days now and have a bit more confidence and go ahead and make the announcement Monday.
Just got a question from when you were watching who asked, do you recommend Rhode Islanders who have soon planned to travel to Florida, one of the hotspot states, call it off? Are they at risk of a quarantine? I know it's tough, but are they at risk of a quarantine on return if you should have a new policy Monday?
Oh, I'm sorry. Are they?
Rhode Islander going to Florida for a family visit or something, but then coming back?
They are at risk of a quarantine or at least a test. So if they're comfortable with that approach, knowing that they have to be tested, then you can either wait till Monday or what I just said. I thought you were going to ask me, should they not travel? And that's a personal decision.
Bill and Dan.
2 questions, unrelated, but I guess related since they're both about Newport. There's a new hotel opening up in Newport today. What can businesses do right now in the private sector to kind of get ahead of? I know you're not announcing until next week what they can do, but is there anything that they can do right now that they can implement from a legal perspective? Can they turn away guests that may have booked that are coming from hot spots, or is there anything that they can
I wouldn't do anything right now. I wouldn't do anything right now. We're never going to say you have to leave. We might say you have to be tested. We might say, you know what I mean? I would say just do nothing and wait a couple days, and we'll have clear guidance. And whatever we do, we'll help you. We'll help you figure it out. So I think proceed for the next couple days.
Secondly, following up on John's question, there's a Columbus statue in Newport as well. I just spoke with Mayor Bova. She seems open to the idea of a council resolution to remove that statue. There hasn't been any violence or anything of that sort there, any mob rule. It just seems like the will of many people in Newport is to have that statue removed. Any thoughts on that?
Yeah. I'm smiling because I always go to the Columbus Day Festa in Newport, and it's a great event. That's her call. That's her call, right? If she feels that she can safely leave it up and the community wants to have it, then she should do that. If she decides, like Alorza decided, that for a temporary period of time, it's a practical thing to do, then she should do that. I think sometimes you just have to make practical decisions and not necessarily think about the statement. At the moment, she has to do what she thinks right to keep her people safe today, tomorrow, and this, in the weeks to come.
Governor, on the housing vouchers, what are you hearing from landlords, why they're not actually taking advantage of it? That there aren't that many or as many as you hope. That's number one. And then just the number two is, if the legislature doesn't pass the ban, are you going to do the change, or are you going to do some sort of executive order?
I don't think I can. I would if I could. If I had that authority, I would. I've supported this legislation for years. I don't think it's a defensible position to discriminate on the basis of source of income. It just discriminates against poor people. What was the first question? Well, I don't have a good answer. I do not have, I don't know if you have a better answer. I don't have a good answer. There's a stigma associated with the vouchers, and I think it's discriminatory. And that's why we're trying to provide an economic incentive to give folks a push to get them to think differently. Sometimes I think, I don't know. I don't have a good answer. It's the way it is. It's the way it's always been. And we're trying to give people an economic incentive to think differently and open their mind to a different approach, to rent to all comers who can pay. These aren't folks who can't afford to pay.
Questions from Brian and then John.
Governor, the diagnosis of a child with multi-system inflammatory syndrome, is that changing your view on anything with like youth sports, summer camps, schools, and how should parents react to that news and considering how to keep our kids safe?
Exactly what the doctor said. We shared it with you. It just happened. So I would say first, you should feel relieved that we're being fully transparent. Secondly, as the doctor said, it wasn't a surprise. We're seeing this in other states. It's a single person. Parents should just do what they've been doing. Be careful for their kids. I can speak as a parent of teenagers. It's hard to get your kids to wear masks. So you have to be on them to do it. It's hard to get your kids to wash their hands. So just everything, be vigilant with your children. Keep them out of crowds. Keep them home if they're sick. Get them their well visits. Make them wash their hands and wear their masks. And if they're going to play sports, they have to follow the rules.
But it won't change anything in terms of...
No, it hasn't affected our thinking.
John.
Governor, when this started, I believe a lot of homeless people were placed in hotels. And I believe that Nine Low Hotel is one of them in Warwick. We've seen a level of increased complaints from some of the neighbors. And the question is, how much longer are people going to be kept in these hotels? And how many people do you have in these hotels?
Yeah, I'm going to let Brett answer the details, and then I want to answer it too.
Yes, John, there's two pieces to the hoteling of Rhode Islanders experiencing homelessness. There's a group of folks who are quarantined for medical reasons. Either they're COVID positive or they've been exposed and therefore need to quarantine. That which is happening at the Wyndham, while we might change facilities, the providing of housing for Rhode Island, homeless Rhode Islanders who are COVID positive. That will continue for some time. There was a second effort, including the NILO, which was an effort to de-densify the shelters because we were concerned about the rate of spread in shelters in dense congregate settings. And that program is going to be wrapping up next week. There's over 100 Rhode Islanders housed in 2 facilities. And that's part of the strategy that the governor has been talking about and part of the impetus for the landlord challenge as well, because the solution is not future hotel stays, but rather permanent affordable housing to provide housing security for Rhode Islanders. And so we've been working closely with the homeless service providers such as Crossroads, who've been a key partner in this. We've tried to, solve the problem from both ends, which is we've provided additional rental assistance to help new Rhode Islanders stave off homelessness, but then we've also tried to address the supply side through the availability of additional units to get landlords to take vouchers from Rhode Islanders because we have vouchers available. We have a lack of available units. And so we are trying to be comprehensive in our approach. We're working with the providers, we're working with the home communities, but the hoteling for the sole purpose of de-densifying the shelters, that wraps up next week on June 30th.
Anything else?
Just briefly, Dr. Alexander Scott on the MISC questions. How is that? I assume that's not a test thing you check, right? It's the doctors observe and diagnose.
Correct.
Are there any suspected cases otherwise right now that they're monitoring, or do you think so far this is the only person who's presented with those symptoms?
This is our only confirmed case. We don't currently have other suspected cases being monitored.
Thank you, everyone.